All right, so this is my interview. Who am I interviewing?
My name is Selena Killian. I'm Director of Clinical Operations for a company called Sangamo Therapeutics.
Next question. Okay, I'm gonna have maybe. How do you use like communication and budgeting and adaptation in your job?
Okay, I'll address those individually. Adaptation. So the world of science can be very unpredictable in that we don't always know how the human body is going to react to the things that we give it. So what we find in trials is you may study your drug for many years, and a lot of the times we do it by starting with animal studies first. And so we have an idea, but animals are not humans, so we don't know exactly how humans are going to react. So when we do give a drug in a study, we are closely monitoring those patients to see if they have any reactions to the drug first. Because when you start a trial, your first target, your first objective is to make sure the drug is safe. So we monitor them to see if they have anything called adverse reactions or adverse events. If that does occur, we also look at whether or not it's related to the study drug or possibly their actual disease that they have. If we do find that they are having adverse events, we may have to adapt and modify the protocol in order to better understand that and reduce the adverse events. So that's one way we adapt.
How do you make sure people in a clinical trial stay safe?
Like I talked about earlier, we monitor serious adverse events and adverse events. So before we get to that place, they run trials in animals, then they would never put it in people. If they find it to be safe in animals, they start at lower doses of the drug and see how safe it is as they increase it. And so they're looking for a drug that has a good safety profile and is effective.
Okay. What are the different phases of a clinical trial?
There's phase 0, which is usually preclinical. Preclinical phase 0, about the same. That's the animal studies. Phase 1 and sometimes phase 2 are where you're looking at safety in people. So they do a small amount of people, test to see if it's safe. Once they move past phase 1, phase 2, they go into phase 3. Phase 3 is a large scale of the trial in a lot of people. And that is, again, to narrow down the most effective dose and just continue to make sure it's safe. From there,
how long does it usually take to develop a new medicine?
If it goes through all the phases and it's not expedited, probably about 10 years. If you include preclinical, maybe 15. A really long time.
What has been the most exciting project you've ever worked on?
Project that I'm working on now. It's probably been the most successful project I've ever worked on.
Okay. And how do you feel about this interview?
It was interesting.
In a good or bad way?
In a good way. I'm hoping that people understand a little bit more about how clinical trials happen.
All right, that's the end of the interview.